A hospital room in Phoenix, Arizona. November 2019. A 21-year-old girl lies on a bed, wrists strapped to the rails. Her eyes have rolled so far back, only the whites are visible. Her spine arches off the mattress at an angle that looks impossible, like a bow drawn too far. Her mouth opens and a sound comes out. Not words, not a scream, something guttural, something ancient. Something that makes the nurse reach for the panic button. Her mother stands in the doorway, rosary beads cutting into her palm. She's watched her daughter transform over 17 days. First the paranoia, then the hallucinations, then the seizures that would not stop. Now this. This thing in the bed that wears her daughter's face but moves like something else entirely. The girl's head turns toward her mother with mechanical slowness. The mouth curls into a smile that does not belong to her. This is the disease doctors mistook for demonic possession. Welcome to Diagnosis Glitch. Today we're opening a case that will make you question everything you think you know about the human mind. Because what happened to Emily Reyes was not madness. It was not evil. It was something far more terrifying. And the scariest part, it could happen to anyone. 17 days earlier, Emily Reyes was studying for her organic chemistry final at Arizona State. Pre-med. Dean's List 3 semesters running. Her mother, Carmen, called every Sunday after church. Her boyfriend, Marcus, was already looking at rings. Emily's plan was medical school, then oncology. She wanted to cure cancer. She was the kind of person who made you believe she might actually do it. The first warning shot came on a Tuesday. Emily was in the library, highlighter in hand, when a headache bloomed behind her eyes. Not a normal headache, the one that felt like pressure, like something was pushing outward from inside her skull. She took 2 Advil and kept studying. That night, her roommate Sophie found her standing in the dark kitchen at 3 a.m. staring at the wall. "Em, you okay?" Emily turned slowly. "You moved my notes." "What? No, I didn't touch your stuff." "You're lying. You've been watching me. I see you." But Emily didn't sleep that night, or the next. By Thursday, she had moved a chair in front of her bedroom door. By Friday, she trusted no one. Pay attention to what everyone missed. Sudden personality change, paranoia, insomnia. These are not symptoms of stress. These are a brain under attack. Friday afternoon, Emily collapsed in the dining hall. Her tray clattered to the floor. Her body went rigid, then started shaking violently. Students scattered. When the paramedics arrived, she was seizing so hard they could barely hold her still. Her teeth had bitten through her lower lip. Blood stained her white blouse. Emergency room at Banner University Medical Center. CT scan. Normal. Toxicology. Clean. No fever. The ER doctor saw a stressed college student who had a panic attack. He spent 7 minutes with her. He prescribed Ativan and sent her home with a pamphlet on stress management. Remember this moment. This was the first chance to save her. It was missed. Because you cannot treat a burning house by watering the lawn. 2 days later, Carmen got the call no parent wants. Sophie's voice was shaking. "Something's really wrong with Emily. She's not herself." Carmen drove 4 hours from Tucson. When she walked into her daughter's dorm room, she found a stranger. Emily sat on the floor surrounded by torn paper, her notes ripped to shreds. She was talking rapidly to someone who was not there, answering questions no one had asked. Her words tumbled over each other, sometimes making sense, sometimes dissolving into sounds that resembled language but were not. "Emily? Baby, it's Mom." Emily looked up. Her face was slack, her eyes were hollow, and then she lunged. It took 3 campus security officers to restrain her. By the time they reached the psychiatric ward, she had to be sedated. The psychiatrist's diagnosis was swift: acute psychotic break, probable early onset schizophrenia. They started antipsychotics immediately. But here's what nobody understood. Emily's mind was not attacking itself. Something else was attacking her mind. The medications did nothing. Emily got worse. She stopped recognizing her mother. She stopped speaking in sentences. Her words came out jumbled, syllables broken, sounds that almost formed meaning but didn't. Then the movement started. Her face began twitching. Her jaw clenched and released rhythmically, her tongue thrust in and out of her mouth. Her arms moved in slow, writhing patterns. The nurses documented it as a side effect of the medications. It was not a side effect. It was the disease showing its face. By day 12, Emily was catatonic. She lay frozen, eyes open, staring at nothing. A feeding tube snaked down her nose. Her body was rigid as a board. And then, without warning, she would erupt into violence, thrashing so hard she broke the bed rails, screaming in a voice 2 octaves lower than her own. Carmen sat in the plastic chair beside her daughter's bed, praying rosary after rosary until her fingers bled. She watched her daughter's body arch backward until only her head and heels touched the mattress. She watched foam collect at the corners of her mouth. She watched her eyes roll back until they disappeared entirely. Carmen was a devout Catholic. She had seen movies. She knew what this looked like. On day 14, she called Father Thomas. Father Thomas was 52 years old, a PhD in theology from Notre Dame. He did not believe in literal demonic possession. He had written papers arguing that most historical exorcisms were misunderstood medical events. He came to Emily's room not to perform a ritual, but to pray with a suffering family. He was not prepared for what he saw. When he entered the room, Emily's head turned toward him with mechanical slowness. Her mouth stretched into a smile that did not reach her eyes. She spoke. The words were not English. They were not Spanish. They were not any language he recognized, but they had rhythm, cadence. They sounded like sentences. He finished his prayers quickly. In the hallway, his hands trembled. "Get a neurologist," he told Carmen. "That girl needs doctors, not priests." Here's what no one understood yet. Emily's immune system had declared war on her brain. Deep inside her body, antibodies were attacking something called NMDA receptors. These receptors are scattered throughout the brain like millions of tiny switches. They shape your thoughts, your memories, your perception of reality. They are what make you, you. Block enough of them, and the brain short circuits. First, the psychiatric symptoms: paranoia, hallucinations, personality changes. Then the neurological symptoms: seizures, movement disorders, speech falling apart. Then, if untreated, catatonia, coma, death. This disease has a name: Anti-NMDA Receptor Encephalitis. It was only discovered in 2007. Before that, every single case was misdiagnosed: schizophrenia, bipolar disorder, demonic possession. But the neurologist on call did not think of it. He saw an MRI with mild inflammation and diagnosed viral encephalitis. Wrong disease, wrong treatment, no improvement. Emily was dying and nobody knew why. By day 16, she was on a ventilator. A machine breathed for her because her brain had forgotten how. Her heart rate swung from 40 to 180. She had coded twice. The attending physician took Carmen into the hallway, put a hand on her shoulder, and said the words no parent should ever hear: "We've done everything we can. You should prepare yourself." And then Dr. Miguel Ramirez walked into the ICU. Dr. Ramirez was a second-year neurology resident. He was not supposed to be on Emily's case. He was not supposed to order expensive tests without attending approval, but he remembered a presentation from medical school, a case from Penn, a young woman who looked possessed. He pulled up Emily's chart: 21, female, psychiatric onset, movement disorder, catatonia. It matched. He ordered 2 tests that would change everything: an antibody panel for her spinal fluid and a pelvic ultrasound. His attending was furious. "You're wasting resources on a psychiatric patient." Dr. Ramirez did not back down. "If I'm wrong, write me up. If I'm right, we save her life." The antibody test came back the next morning. Positive. Emily's spinal fluid was flooded with the very antibodies that were destroying her brain. But why? Why would her own body attack her own mind? The pelvic ultrasound answered that question. Hidden in Emily's ovary was a teratoma, a tumor that grows teeth, hair, sometimes bone, and sometimes brain tissue. Emily's teratoma contained nerve cells. Her immune system detected this foreign brain tissue and produced antibodies to destroy it. But those antibodies did not stay in the pelvis. They traveled to her brain, and they attacked the NMDA receptors there too. Her body had been trying to fight a tumor, and in the process, it had nearly murdered her mind. Emergency surgery within hours. The teratoma was the size of a golf ball. When the surgeon cut it open, he found hair, teeth, and a clump of tissue that looked disturbingly like a tiny brain inside a tumor inside her body. But the damage was already done. Her brain was inflamed, soaked in rogue antibodies that were still attacking. She needed her blood cleaned. Plasmapheresis. They ran her blood through a machine that filtered out the antibodies, then returned the cleaned blood to her body. They pumped her full of immunoglobulin to reset her immune system, and they waited. Day 20, no response. Emily lay catatonic, a machine breathing for her. Day 23, a nurse noticed her finger twitch, not a spasm, a movement, deliberate. Day 26, her eyes tracked her mother's face across the room. Day 30, she squeezed Carmen's hand. Day 34, her lips moved, a whisper, hoarse, barely audible. "Mom?" Carmen collapsed over her daughter's bed, sobbing so hard she couldn't breathe. That voice, her daughter's voice. Emily was still in there. The road back was brutal. 3 months of rehabilitation, relearning to walk, relearning to speak, relearning to think. The memories returned in fragments. Emily remembered the paranoia as if it had been real. She remembered the terror of being trapped inside a body she could not control, screaming inside a mind no one can hear. She asked about Father Thomas, about what she had said to him. Carmen told her everything. Emily's response, "I wasn't possessed, I was sick, and everyone was looking at the wrong thing." Emily was lucky. She had a doctor who remembered a case. She had a mother who never stopped pushing. She had time. Not everyone gets that. If you want to know what happens when this disease is missed, when the diagnosis comes too late, when the ending is not a recovery but a tragedy, we covered a case on this channel that still haunts me. A new mother in Austin, Texas. Same disease, different outcome. Teeth found in a tumor just like Emily, but the antibodies were never tested in time. The rumor said they found teeth in her brain. The truth was worse. I'll leave a link to that video. It is one of the hardest stories we have ever told, but it is one of the most important. 1 year later, Emily returned to Arizona State. Different major now, neuroscience. She wanted to study the brain that had almost destroyed her. She was in the library again. A girl across the table waved at her. Emily's mind went blank. She knew this face. She had seen it before, but the name... For 3 seconds that stretched into eternity, the name was gone. Her heart pounded. Is it happening again? Then, "Hey, Sarah, want to grab coffee?" The name came back. Just stress. But every night before she sleeps, Emily checks her own eyes in the mirror. She looks for the stranger who once lived there. She knows the statistics. 12 to 20% of patients relapse. The monster could return. She lives with that. Before 2007, every single case of this disease was misdiagnosed. Hundreds of young women locked in wards, labeled schizophrenic, while tumors with teeth grew unchecked in their bodies. Historians now believe many medieval possessions were exactly this: young women, convulsions, speaking in tongues, eyes rolling back. Some were burned as witches. Some were exorcised until they died. The question you should be asking: how many people are lying in psychiatric wards right now, diagnosed as insane, while a tumor hides in their body? How many families are calling priests when they should be calling neurologists? Your personality, your memories, the voice in your head you think is you, it all depends on receptors so small you need a microscope to see them. If your immune system decides those receptors are the enemy, you do not go crazy. You do not lose your mind. You lose yourself. Someone else moves in, and no one believes the real you is still trapped inside, screaming. The monster is never outside the body. It's always in the machine. This is Diagnosis Glitch. The exorcist was wrong. The diagnosis was waiting. I'll see you in the next waiting room.